Many seniors get routine blood tests every year to check cholesterol, sugar, thyroid, kidneys, liver, vitamins, and more. These reports help doctors decide medicines, detect problems early, and track how well treatments are working. But what many people don't realize is that the way you prepare before the test can change the results just as much as the test itself. A simple cup of tea, a rushed walk to the lab, or taking the wrong pill at the wrong time can make numbers look worse, sometimes leading to unnecessary worry, repeat tests, or even wrong treatment. None of these mistakes happen on purpose. They usually happen because no one clearly explains what to do and what not to do. The good news is that with a few simple habits, your reports can become more accurate, easier for your doctor to read, and far more useful for your health. In this guide, we'll go through the 10 most common mistakes seniors make before blood tests and what doctors recommend instead. These aren't complicated medical rules. They're small, practical steps that protect your health, save time and money, and prevent confusion. Whether you're getting blood work done for diabetes, cholesterol, thyroid, or a routine checkup, understanding these points will help you walk into the lab prepared and confident. Let's start. Mistake number 1 is something almost everyone has done at least once. Number 1, not fasting correctly, is one of the most common mistakes seniors make before blood tests, and it can completely change the results your doctor relies on. When a test requires fasting, it usually means you should not eat or drink anything except plain water for 8 to 12 hours beforehand. Many people think tea, black coffee, milk, juice, or even just a biscuit doesn't count, but even small amounts of sugar, fat, or caffeine can raise blood sugar, insulin, and triglyceride levels and alter cholesterol numbers. Chewing gum, sucking on candy, and smoking also stimulate the body and technically break the fast. Another issue is fasting for too long, such as skipping dinner and waiting 14 to 16 hours. This may cause weakness, low sugar, dizziness, and inaccurate readings as well. The goal is a comfortable, safe fast. Finish dinner early, choose light food, and then only sip plain water until the test. If you're diabetic, on insulin, or feel shaky when you don't eat, always ask your doctor what to do. Some blood tests don't require fasting at all, and sometimes timing or medication adjustments are needed. On the morning of the test, avoid tea, coffee, lemon water, or detox drinks, and go straight to the lab so the fasting period isn't stretched unnecessarily. Once the blood is drawn, you can eat normally unless your doctor advises otherwise. Remember, fasting isn't about being strict for the lab. It's about ensuring your results truly reflect your health. Doing it correctly helps your doctor see the real picture, prevents confusion, and avoids repeating tests, extra costs, and worry. If you're ever unsure whether a test requires fasting, simply ask. A 30-second question can save you a lot of trouble. Number 2, taking regular morning medicines before a blood test is another mistake that can quietly change the results, sometimes enough to confuse the doctor or make it look like something is wrong when it isn't. Many seniors wake up and automatically take their thyroid tablets, blood pressure pills, vitamins, painkillers, or herbal supplements out of habit. But several medicines can interfere with test values. Thyroid tablets can alter thyroid results if taken just before the sample. Biotin-containing hair and nail supplements can distort thyroid and hormone tests. Painkillers and anti-inflammatory drugs may affect kidney and liver numbers. Even routine multivitamins and iron tablets can change hemoglobin, iron studies, and some chemistry values. That's why, unless your doctor specifically says otherwise, it is usually better to carry your medicines with you and take them after the blood is drawn. However, and this is very important, never stop certain life-saving medicines on your own. Heart medicines, some blood pressure drugs, seizure medicines, and many diabetes medicines may need to be continued, and sometimes your doctor actually wants to see how your blood looks while you're taking them. Insulin and diabetes tablets especially require individual advice because skipping them can be risky. The safest approach is simple. When your test is scheduled, ask in advance, which medicines should I take and which should I wait on the morning of the test? On test day, bring a list of everything you use, including herbal products and over-the-counter pills, and inform the lab. If by mistake you took something before the test, don't hide it. Just tell the technician or doctor so they can interpret results correctly. Handling medicines the right way prevents misleading reports, unnecessary repeat tests, and protects your health. Number 3, drinking too little water before a blood test is another mistake that seems small but can make a big difference, especially for seniors. When the body is dehydrated, the blood becomes slightly thicker and more concentrated, which can falsely raise values like creatinine, urea, hemoglobin, and sometimes even sodium. Dehydration also makes veins shrink and become harder to find, so the technician may struggle, need multiple attempts, or the sample may clot and need to be taken again. Many seniors believe that because they are fasting, they should avoid drinking anything at all, but fasting usually means no food or calorie-containing drinks. While plain water is not only allowed, it is encouraged unless your doctor has specifically told you otherwise. Having 1 to 2 glasses of water in the morning helps maintain circulation, prevents dizziness when you stand, and makes the blood draw smoother and less painful. On the other hand, drinking too much water quickly is also unnecessary. Overhydration can dilute some values and may cause lightheadedness. The goal is normal, gentle hydration. Sip water through the evening. Avoid excess salty or very sugary foods overnight, and then have a glass or 2 of plain water before leaving for the lab. Seniors with kidney disease, heart failure, or swelling should check with their doctor about how much water is safe, because their fluid limits may be different. If you feel dry mouth, headache, dark urine, or weakness on the morning of your test, it's a sign you likely haven't had enough fluids. Remember, good hydration doesn't change the truth of the report. It simply helps the sample reflect your real health and makes the process safer and easier. When in doubt, ask the lab or your doctor how much water is right for you. Number 4, exercising just before a blood test is another mistake many seniors make, often with good intentions. Some people think, let me walk fast or climb stairs so I reach the lab on time, or they continue with their regular morning yoga, cycling, or gym routine. But strenuous activity can temporarily change several blood values. Exercise releases enzymes from the muscles, such as CK, that may look like muscle injury on the report. It can also raise liver enzymes, lactic acid, and blood sugar for a few hours. Even something as simple as dragging heavy grocery bags or briskly climbing several flights of stairs can push your heart rate and stress hormones up, making the numbers appear abnormal. For seniors, especially those with heart disease, arthritis, or balance issues, pushing hard before a test can also cause dizziness, chest discomfort, or fatigue. The best plan is to keep the body calm the day before and the morning of the test. Light movements like slow walking inside the house are fine, but avoid workouts, yoga flows, weight training, or long walks until after your blood has been drawn. If your appointment requires fasting, doing exercise while fasting can make you feel weak, shaky, or even faint at the lab. Once your blood sample is collected and you've had something to eat, you can usually resume normal general activity unless your doctor has advised otherwise. If your routine includes cardiac rehab or prescribed exercise, ask your doctor whether you should skip it on test day or reschedule the session. Remember, the purpose of resting is not to restrict you. It is to ensure your blood results reflect your usual baseline, not temporary changes caused by physical exertion. A calm body gives the most accurate report. Number 5, eating a heavy, oily dinner the night before a blood test is another mistake that can quietly distort the results, especially tests related to cholesterol, triglycerides, liver function, and blood sugar. Many seniors think, the test is tomorrow morning. By then, everything I ate will be digested, but the body continues processing fats and sugars for many hours. Fried foods, ghee-rich curries, butter, creamy desserts, sweets, pizza, and late-night snacks can leave fats circulating in the bloodstream the next morning, making triglycerides shoot up and sometimes making the blood sample look milky. A very heavy meal can also push sugar levels higher and may temporarily disturb liver enzymes, leading to anxiety or unnecessary repeat testing. Another problem is timing. Eating late at night shortens the true fasting window, so you may arrive at the lab technically not fasting, even if you believe you are. The better approach is simple. Finish dinner early, keep it light, And choose foods that are easy on the stomach, such as vegetables, dal, chapati, a bowl of soup, or a modest portion of rice without excessive oil. Avoid sweets, deep-fried items, alcohol, and large portions. For people with diabetes, skipping dinner entirely is not a good idea either. It can cause low sugar, shakiness, and poor sleep. So aim for a balanced, sensible meal and confirm with your doctor if you need specific instructions. If by mistake you did eat something very heavy or late and your test is routine, tell the lab or consider rescheduling so the results are reliable. Remember, preparing well the night before doesn't change your health. It simply prevents misleading numbers and helps your doctor see the true picture of what's happening inside your body. Number 6, drinking alcohol the night before a blood test is another common mistake that can seriously change what your reports show, especially for seniors. Alcohol affects the liver first, but its impact spreads throughout the body. Even a couple of drinks can temporarily raise liver enzymes, increase triglycerides, disturb blood sugar, and cause dehydration, all of which may make the results look worse than they really are. In some people, alcohol taken the previous evening can still be detected the next morning, and the body may still be busy clearing it out. For seniors, whose liver and kidneys may already be slower, this effect can last longer. Alcohol also interferes with certain medicines such as diabetes tablets, blood thinners, and blood pressure drugs, and combining the two can make the blood draw experience riskier, causing dizziness or bleeding. The safest rule is to avoid alcohol completely for 48 to 72 hours before routine blood tests, unless your doctor has given specific instructions for a special test. If you accidentally had a drink, do not try to hide. Tell the lab or your doctor, because they may interpret the values differently or ask you to repeat the test later. Drinking alcohol to calm nerves before a test is especially dangerous because it dehydrates you, makes veins harder to find, and increases the chance of fainting. Remember also that so-called light, mild, or homemade alcohol is still alcohol. The body treats it the same way. Staying alcohol-free for a couple of days helps protect your liver, avoids misleading numbers, and prevents unnecessary worry, diagnosis confusion, or extra expenses from repeating tests. When in doubt, choose water, herbal tea without sugar, or simply rest. Your reports will be clearer, and your doctor will get a much truer picture of your health. Number 7, not informing the lab about supplements is another mistake that can quietly distort blood test results, especially for seniors who often take multiple vitamins, herbal powders, or natural remedies. Many people assume that because something is sold over the counter and labeled as herbal, Ayurvedic, or natural, it cannot affect medical tests. But that is not true. One of the biggest culprits is biotin, often found in hair, nail, and skin supplements, which can seriously interfere with thyroid tests, heart markers, and certain hormone results, sometimes making them look dangerously abnormal when the patient is actually fine. Fish oil and omega-3 supplements can alter triglyceride readings. Iron tablets and multivitamins can change hemoglobin, iron studies, and B vitamin levels. Herbal products like ashwagandha, ginseng, or turmeric may influence liver enzymes or interact with medicines that thin the blood. Because labs and doctors interpret numbers based on the assumption that no external substances are altering them, forgetting to mention supplements can lead to wrong conclusions, unnecessary worry, repeat tests, or even changes in treatment that weren't needed. The safest approach is simple. Carry a list, or the bottles, of everything you take, including powders, syrups, drops, tonics, protein supplements, and immune boosters, and show it to the lab or doctor before your blood is drawn. In some cases, they may ask you to stop certain supplements 24 to 72 hours before the test, so the results are accurate. Never stop prescription medicines on your own, but do be honest about every product you use. If you already had your test and later remember a supplement you forgot to mention, inform your doctor. It can help them interpret the report correctly. Transparency saves time, money, and stress, and ensures your results truly reflect your real health. Number 8, doing blood tests when you are sick, highly stressed, or badly sleep-deprived is another mistake that can easily confuse the results, and it's especially important for seniors. When the body is fighting an infection, dealing with fever, pain, or emotional stress hormones like cortisol and adrenaline rise. These can push blood sugar higher, increase white blood cell counts, and elevate inflammation markers, even if you don't normally have those problems. Poor sleep the night before can also raise blood pressure and sugar and may make you feel dizzy during the blood draw. If the test is routine, a checkup, cholesterol, thyroid, or yearly health panel, it is usually better to wait until you have recovered and your body has returned to its normal state. However, if the doctor ordered tests specifically because you are sick, for example, fever, infection, chest pain, or monitoring condition, then those tests should not be delayed because they help guide urgent treatment. Seniors with chronic illnesses like diabetes, kidney disease, or heart problems should always check with their doctor before postponing anything. Another point many people forget: emotional stress, arguments, rushing to the lab, or worrying too much about the needle can also temporarily alter some values. Taking a calm approach, arriving a few minutes early, and resting quietly makes a difference. If you had fever, diarrhea, vomiting, lack of sleep, or an extremely stressful night before the test, tell the lab or mention it on the report form so your doctor knows the context while interpreting results. The goal is simple. Your blood work should reflect your usual health, not a temporary reaction to illness or stress. Waiting a few days, when appropriate, often leads to clearer, more accurate reports and avoids unnecessary anxiety. Number 9, ignoring timing instructions for blood tests is another mistake that quietly leads to confusing or misleading reports, and it becomes more common as medicines and health conditions increase with age. Many tests are time-dependent, meaning the result changes naturally through the day, so drawing blood at the wrong time can make it look abnormal even when everything is fine. For example, thyroid tests are ideally done in the morning, usually before taking the thyroid tablet, because the medicine can temporarily alter levels. Cortisol, the body's stress hormone, is highest early in the morning and lowest at night. So if it is taken at the wrong time, the doctor may get an inaccurate picture. Fasting sugars, lipid profiles, some vitamin levels, and drug monitoring tests often have specific instructions about how many hours to fast and exactly when the sample should be collected. Seniors sometimes go to the lab in the afternoon or after a snack thinking it won't matter, but it does. Another issue is inconsistent timing. Doing one test at 7 a.m. and the next follow-up at noon makes comparison difficult. The safest approach is to carefully read the lab form and ask, what time should I come, and should I take my medicines before the test? Mark the plan on your calendar so you don't forget. If a delay happens or you accidentally eat something, tell the lab instead of staying silent. It helps the doctor interpret the results correctly, and sometimes the test may simply be rescheduled. Remember, timing isn't about rules for the lab's convenience. It ensures your numbers are measured under standard, repeatable conditions. Following the right timing saves money, prevents repeat visits, and helps your doctor make the right decisions for your health. Number 10, not resting before the blood draw, is another simple but important mistake seniors often make. Many people rush to the lab, climb stairs, walk fast, stand in line, worry about being late, and then sit down immediately for the test. But when the body is stressed, heart rate and blood pressure rise, stress hormones go up, and blood sugar may increase temporarily. Even something as routine as carrying heavy bags or arguing on the phone can stimulate the body enough to change certain values. For some seniors, rushing on an empty stomach can also cause dizziness, sweating, or even fainting when the needle is inserted. The best approach is to arrive a little early, sit quietly, and allow the body to settle before the sample is taken. Usually, 10 to 15 minutes of calm rest is enough. Sit comfortably, breathe slowly, avoid crossing your legs, and do not keep checking your phone or worrying about the process. If you feel nervous, inform the technician. They can help you lie down or give extra support. Seniors with heart disease, low blood pressure, anemia, or anxiety benefit especially from taking the short rest. Another helpful tip is to avoid caffeine, smoking, or climbing multiple flights of stairs right before entering the lab. Once the blood is drawn, press gently on the cotton, Don't rub, and wait for a few minutes before walking out. If you feel lightheaded, sit back down and ask for help. Resting isn't a luxury. It is part of correct preparation. It makes the procedure safer, reduces the chance of fainting or bruising, and helps ensure that the results show your normal condition, not a moment of physical or emotional stress. A few quiet minutes can make your reports clearer and your experience much more comfortable.